This is the story of a prominent leader dedicated to improving the health and welfare of society. After earning her MPH in epidemiology from the Harvard T.H. Chan School of Public Health, she now serves as Director of Research at Workit Health. She is currently pursuing a DrPH in Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. She is well known for her strong compassion and dedicated work ethic. This is the story of Marlene Lira, also my big sister.
Thanks so much for having me, John Lincoln. I'm really excited to chat with you today.
Of course, and thank you so much for joining the show. I know you'll have a lot of valuable information for the audience. So let's get into it. What inspired you to pursue a career in public health, specifically focusing on substance abuse?
Yeah, so my path towards public health was actually not really intentional. I kind of fell into it. As an undergraduate, I studied philosophy and liberal arts at St. John's College, which is known for its great books curriculum. And I really enjoyed thinking about um, philosophical and existential questions related to life. And I knew that I wanted to marry those questions with direct impact. And when I first graduated from college, I actually thought I wanted to go to medical school. But because I had not completed all the pre-med requirements, I needed to do those. So in order to apply for medical school, you need to have completed biology and chemistry and organic chemistry classes like that in order to take the MCAT and apply. So I decided to work on those classes while working, and I found a job in research. And this was at Mount Sinai Hospital back in 2010 or so, 2010, 2011. Um, and I knew instantly that I loved research. So it was a study looking at medication adherence among people with HIV and who also had high blood pressure. And very quickly, I realized that there was something really drawing me towards research. And a little bit later, my husband and I moved to Boston. He started his graduate school there, and I got a job at Boston Medical Center. Um, and it was also kind of in the HIV, hepatitis C space, but it really had a strong component related to substance use. And from there, I just felt like I really found my footing in substance use research. And as time went on, I realized I actually didn't really want to go to medical school, but I really wanted to learn more about research and math and statistics in order to be able to ask questions and then try to answer them with data. And um, I I kind of just stayed in this track, continuing to progress. I realized though that one of the reasons why I felt so strongly about being in substance use research was because of my own experiences with substance use within our family. And we have the same dad, but we have different moms. And both our dad's side of the family and also my mom's side of the family had a history of challenges with substance use. And so it felt very personal to me. It felt very relevant. And there's just such a huge public health impact that comes from downstream health outcomes of substance use that I just really felt like I had found my calling. I didn't like intend to go into it from an early age, but I feel like my life trajectory has kind of continued to take me like in a way that's been really meaningful to me, in terms of like having the intellectual curiosity and the stimulation that comes from my job, and being able to kind of ask those philosophical questions, but then also having a real world impact. So that's why I love public health. It really has that practical side and also that intellectual inquiry as well.
Can you explain a little bit about how your job in public health relates at all to philosophy?
Yeah. So I think one of the exciting ideas or what exciting opportunities in public health is that we get to think about questions like what um, what is the right policy in order to prevent personal harm, and what's the right balance between individual liberties and free choice and population level interventions that can have a lot of public health impact. And I think that we see those types of questions play out a lot in politics as well. A lot of the questions that are currently taking place in the public discourse, and it's September of 2025 for people listening, around Medicaid, around public health, vaccines, around individual choices with one's body. Those all kind of straddle these philosophical questions. And they're relevant and they exist within so many different dimensions of public health research as well. So, say you wanted to become an expert in, I don't know, cardiovascular surgery, like that niche has its own set of ethical questions that people are constantly grappling with. And those are the questions that really, really excite me. And also just bringing back, like, what is the greatest public health benefit and impact that we can come up with in a creative way that also minimizes harm, minimizes challenges, and where do you get that equipoise? So I think that public health and research continually grapples with those types of philosophical questions.
Now, I know that you said in college you studied philosophy. Is it common for people like your coworkers in public health to also have a background in this sort of liberal arts studies?
Yeah, I that I would say it's common, but I definitely have colleagues who had similar undergraduate experiences. I think what's really interesting about studying the liberal arts as an undergraduate is that it actually prepares one for a variety of careers. So often people go into law, or maybe they go into medicine, but it's also not uncommon for people who study the liberal arts to become entrepreneurs or to go into computer programming. I think what's really unique about the liberal arts is that it sets people up for critical thinking and civil discourse. And those skills, I think, are applicable to almost all jobs and career pathways in society. So I think it's a really great background for students to consider when they're pursuing their undergraduate educations.
Now, going back to your personal experience, can you share one pivotal moment in your educational or professional career that made you realize this is what I want to do? Or was it just sort of gradual?
Yeah, so it was definitely gradual. As I mentioned, I kind of fell into substance use and infectious disease research, and over that time period, I I was a young adult, right? And I was processing in my own way, kind of psychologically, my adolescence and my youth, and the different experiences that I had gone through, some of which were related to substance use. And so in that sense, it was kind of gradual, and I realized, like, this is meaningful to me because my mom is in recovery. This is meaningful to me because My dad was a heavy drinker. This is meaningful to me because my grandpa was in recovery. Um, but but funnily enough, like it took me many years to realize that it wasn't like a conscious choice. Um, that said, after our dad suddenly passed away in 2014, that was a really pivotal moment that really accelerated a lot in my career, a lot in my personal life as well. Um, when he passed away suddenly, I was pregnant with my son, and we were actually without a home for several months, homeless. We were in Mexico at the time that the accident happened. Um, and my husband was doing a fellowship there. And we suddenly went to California. We kind of stopped things in Mexico. We didn't have a home in Boston. And I was 4 or 5 months pregnant at the time. Um, and it was a very, very scary experience. And I was pregnant while processing grief, while um, being very worried about you because you were involved in that accident as well. Um, and that catalyst, that moment, ended up being a huge catalyst for me. Afterwards, I realized I wanted to get more training and advance my career. I wanted to be able to do my own quantitative analyses and to be able to lead my own studies. So I ended up applying thereafter to do my MPH program. And and after that, I thought, well, this is really excellent. I feel like I have the data analysis skills to kind of go in whatever direction I want with data, but like now I want to know how to be a public health leader, and I want to know how to change the law. I want to know how to make, global impact with this knowledge. And so that kind of then led me to apply to the DrPH program in health policy. So in some ways it was gradual, but I feel like the loss of our dad and that really challenging period in 2014 that I would say for me lasted up until 2016 or 2017, really started to propel me forward in a direction that and with an intensity and grit that I didn't have prior to that.
Going through this experience must have been very difficult and challenging, and I'm sure you must have felt very scared at many points in time. Are there any role models or ideas that you clung on to help you through this treacherous time?
Yeah. I think that I that's a great question. I think I thought a lot about our dad. He was such a role model for me in many ways, and he was he's his memory has continued to be kind of a guiding spirit for me. Um, I also looked to writers like Marcus Aurelius and kind of some of that Stoicism, and different, you know, different writers to try to think about my own experience. Um, but what's really interesting is that I I actually started running after that, like running, like physical activity, and that was actually ultimately how I worked through a lot of my grief. Um, as a kid, I was never really like into physical fitness, or I don't know. I played tennis for a few years, but um, I did a lot of music and marching band in part because I didn't want to do PE. I didn't think it was fun. I didn't know how to enjoy it as a teenager. Um, and I remember um, when my son was, I don't know, 6 months, a year old, I was so overwhelmed, had a little baby, had no idea what I was doing with my career. I was so sad in just dealing with our dad's death. Um, and I like needed a little bit of time to myself. And so we were living in an apartment complex at the time and it had a treadmill. And so I like went on the treadmill for, I don't know, 20 minutes and I like walked basically. And and then I kept doing it. And then I started listening to like podcasts or apps. At the time, this was like before Peloton and kind of those big fitness apps got big, but there was an app that I listened to with audio coaches that would like try to like help you to run. And it was such a powerful experience for me. And I just started running. And first, like I couldn't even jog like for 3 minutes at the beginning of it. But I like trained for a 5K and then I trained for an 8K run. And then I ultimately did like a 15K. And having that time to myself, having that physical activity, having that quietness and stillness ultimately was was very, very cathartic for me and helped me to overcome a lot of what was going on emotionally for me at the time. That said, I did have some really wonderful mentors and colleagues who helped me. There are a few doctors that I worked with at the time, and I was involved in their research studies, and they were so supportive of me, and they really believed in me, and they gave me all the time that I needed to work through those experiences. And they were just really important sources of support. In addition, our sister, Sophie, has always been there for me. My husband, Obed, he kind of worked through a lot of that, like alongside me at the same time he was going through a lot of those emotions as well. Um, and and so it was kind of like a constellation of various people, and my mom and family. It's so hard when one goes through a challenging experience because people have different amounts of support to give, right? And people who are going through those experiences may or may not have a lot of people to draw on. And so for me, it was kind of this combination, cobbling together different things from like taking up this very physical activity, and then also having all of this psychological support and help from others.
In which ways in specific do you think running helped you through this time?
Yeah, so I think it helped me to build my own confidence, really. I remember being on some like long runs and really struggling because like I didn't know what I was doing. Again, I totally novice, like never really into exercise before. And just like thinking about the little engine that could of like, I think I can, I think I can. I know that sounds um so simple, but like genuinely, I didn't know that I could do something that hard before then. And proving to myself that I could do something like, a 9 mile run, which seemed unfathomable to me before. Like, really, like, there was no way that I ever thought I could do something like that. Made me think, yeah, I could take the GRE and apply to grad school. Like, I don't know, I I could do that run. So like how hard can it be to just study for this test? So I studied for the GRE and I took it. And then I thought, well, I studied for the I'm gonna apply to Harvard and Johns Hopkins. Those are the two schools that I want to go. I don't know. I mean, I'll just try it. What do I have to lose? Like, I don't know. And I got into Harvard and I was like, I got into Harvard. And again, these things that previously I didn't think I was capable of, I probably wouldn't have even tried for. Like, I wouldn't have even attempted it I suddenly had the self-confidence to say like, well, why not? Like, I know I can do hard things. The worst that can happen is I'll get a rejection letter, a denial letter. Um, but like I know my worth, and it's not contingent on, some school accepting me. And and that outlook on life, like, has just really shaped the way that I approach things now. And I think running gave me the confidence to know that like my worth is not really based in anything that society has to say. It's internal. Um, and that's very, very liberating. Um, yeah.
Well, that's wonderful. And challenges like those, like running, what I'm getting from you is that they can be kind of like a cycle that keeps repeating. And without anything, like if you don't have any confidence to begin with, it can be very challenging to get started. But once you already have some confidence from what you've done, it can be easier to keep moving up and up. Um,
Absolutely. Yeah, it's like a snowball effect, right? Like it's hard to start forming that initial snowball. But you kind of just like keep packing it on and you keep rolling it, and then it starts getting bigger and bigger. Um, and and also put it, I think shifting the locus of control from external factors to internal factors, and saying like, well, what is it that I want to try? What is it that I want to do? I think that that also helps contribute with this cycle. But absolutely, I think it can continue to really grow once you plant the seed.
yes, I definitely agree. And as many famous um, philosophers have said, I'm not really sure which one in specific, but you are just your thoughts. And that idea can be, like you said, very liberating because your identity isn't based on external stuff, but just internal stuff. Anyways, moving on to your work experience, how do you approach researching, um, how do you approach translating research findings into practical policies?
Yeah. Um, Descartes, by the way, said, I think, therefore I am. Um, but yes, so in terms of translating research findings into practical policies or interventions, I think a lot of this is problem solving, and trying to really define the problem so that you can understand the solution. So I can give you an example. In my workplace, Workit Health, we're a telehealth provider that treats individuals with addiction, so opioid use disorder, alcohol use disorder, and we have several thousand patients across many states. Um, and for opioid use disorder, so opioid addiction, which is one of the biggest public health challenges of our time with the opioid overdose epidemic, um, there are several FDA approved medications for opioid use disorder. And one of them reduces mortality by like 50%. So reducing risk of death by 50%. Really, really effective. There aren't very many pills or tablets or films, or there aren't many medications in medicine that will reduce somebody's risk of death by 50%. Like that is really incredible. Um, and this medication can be gotten at the pharmacy, a typical Walgreens, CVS, or an independent pharmacy in people's communities. But we found that a lot of people have challenges when they pick up their prescriptions at the pharmacies. And it turns out that there are a lot of factors on the pharmacy side that make it very challenging for pharmacies to stock this medication. And when people can't get this medication, it's not great. Like people start to feel very, very sick within a matter of, you know, hours to a day or two. And it puts them at risk of returning to using illicit drugs like heroin or fentanyl, which then can like increase their risk of death through things like overdose. So it's very important that people have continuous access to this medication. Um, and so, because we've had this problem, it's made me wonder, well, what can we do on a local level, on a state level, on a federal level, to increase access to this medication? And it turns out that San Francisco was having a similar challenge where these pharmacies didn't have the medication in stock. And San Francisco was able to adopt an ordinance saying basically every pharmacy has to have 2 extra prescriptions on hand for this medication at any time. And it's like, and now as a result, like a lot of the pharmacies have this medication, right? So now I'm starting to work with folks in New Mexico to think about, well, how could we adapt the San Francisco law, the San Francisco ordinance, to make sense for a New Mexico context? And what could we do to make it easier for pharmacies to have this medication in stock? And what can we do on a federal level to help? Because it turns out this is actually like a national issue. It's not just happening in San Francisco. It's not just happening in New Mexico. So I think this is a really nice example of how we did a survey. We asked people what their experiences were. Turns out a third of people had to go without medication in the last year because of a challenge at the pharmacy. And now it's kind of naturally led to initiatives in some of the associations that I'm in around policies that could fix this problem. So it's almost like a call and then an answer, right? Research helps to unveil and highlight some of the challenges. And then the policy side is trying to say, well, what can we do to try to fix this challenge? And it doesn't seem, it probably doesn't seem like that big of a deal and this isn't like an issue that most Americans know about or would even really recognize. But it directly impacts overdose rates, which affects, how many people are dying, which affects all of these families, children, communities, has all of these downstream impacts, right? So I think that's a really nice way to kind of show how research can translate into policy. And I'm so happy that the San Francisco ordinance passed, and hopefully that will inspire other states like New Mexico, where I am, but also Michigan is considering similar legislation to really try to help to improve this issue.
Earlier, you were talking about how the role of the people you know and can support you impacts your journey in recovering through a difficult time. This might be a little similar to someone who has a drug addiction. Do you think so? I'm just saying, like, how does the role of your family and the people who can support you relate to one's ability to overcome drugs?
Yeah, so I think it's really really relevant, in the same way that somebody who has, say, a diagnosis of cancer really really benefits from a strong support network, or somebody who has experienced a heart attack or a stroke needs that supportive community. Substance use disorders are kind of seen in the same way in the medical community as being a medical diagnosis, with brain changes, and it's so important for people to have a sense of connection and community. Um, there's a saying kind of in the addiction community that the opposite of addiction is community. I think I'm getting that right. Something along those lines. Or maybe the opposite of addiction is connection. But really that shows kind of this overarching need for support. At the same time, there's also research to show that people who have adverse childhood experiences actually are at higher risk of things like substance use disorder, as well as other health challenges later in life. And that the brain can actually start changing before you even use substances, but as a result of trauma that one experiences. And that's directly tied to things like family and support, or the lack thereof, and like neglect and abuse, and food insecurity, housing instability. So I think all of these things are really related. As humans, we need love, we need connection, we need support, and it's it's not just that people need love and support to overcome substance use disorders, but we actually need those things in order to prevent them in the first place. So I think they're very, very connected. At the same time, I would say that everybody's recovery experience for individuals who have a substance use disorder is unique and different. And what one person might need in terms of support from community could be very different from what another person might need. And the great thing is that there are these evidence-based medications that are really, really effective when it comes to opioid use disorder. And that really underscores how it's this physical medical condition that is being treated. And these medications basically stabilize the person's brain so that they're not feeling these intense cravings. They're not feeling withdrawal symptoms. So there's like the physical component, but I think the emotional connection side is also really, really important, not just in overcoming addiction, but like in preventing it in the first place.
Besides just pharmacies not supplying a certain, um, what is it called?
A
A
medication.
medication.
Yeah.
Besides just that, what else is a very common reason why some um, drug addicts aren't able to get the help they need?
Yeah. So um, in the addiction space, we really like to try to talk about people with what's called person first language. So I always try to say, a person with a substance use disorder, person living with addiction, because the the term addict can feel really stigmatizing. That said, that term is used, all throughout the country. It's like a very common term, but I actually think it speaks to exactly what you're wondering about, which is, what are some of the bigger challenges? And I think one of the biggest challenges is stigma, actually. And by that, I mean people thinking that individuals with substance use disorders are less deserving, are unworthy, are morally flawed. Um, I don't think anybody with a substance use disorder would choose to, develop a substance use disorder. Um, and I think that larger stigma makes it really, really challenging for people to um, kind of at all points access treatment. So internally, it could be like stigma impacting a person's maybe fear in retribution if they go and get help, acknowledgement that maybe they need help, but much larger than that, than the kind of internalized stigma. I think there's a lot of externalized stigma. And what I mean by that is there's stigma in healthcare systems, by people who work in medical centers, by family members, by communities, and so there's just this larger atmosphere that makes it very, very challenging for somebody to reach out and get help. And I think that's also why platforms like telehealth are so exciting in the addiction space, because somebody can get on a Zoom call just like you and I are having right now and talk to a medical provider in the privacy of their own home, or in a private space in a library, or very, very easily talk to somebody who's compassionate, who understands the science, and who can treat their medical condition. But aside from stigma, there are a lot of other factors too, that are making it challenging to treat addiction in the United States. There's a shortage of behavioral health providers in the entire United States. And a lot of medical providers don't feel adequately trained to treat addiction. So it's become easier over the last several years for healthcare providers to prescribe the medications needed for opioid use disorder. But a lot of them may feel hesitant. They may feel like they don't have the expertise. They didn't learn it in medical school or whatever training they underwent to become a healthcare provider. And so there's also this lack of providers. And then there are other kind of structural issues, like reimbursement rates from Medicaid being very, very low, sometimes not being enough to cover the costs of the treatment that's being provided. So there are financial considerations. And then I would say there are these larger, even larger, more macroscopic issues that contribute to this challenge, like the housing crisis and poverty and food insecurity and wage inequality, and all of these larger societal issues that our country is dealing with right now. They all kind of have these downstream impacts on addiction, right? So if somebody becomes unhoused, it can create a whole cycle of challenges for them. And if you throw in a substance use disorder, it just magnifies everything, right? And a lot of our state governments may not have the resources to help everybody who needs help, right? And that goes for local governments like cities and counties as well, and even on the federal level. So that's all to say, it's really complicated. There are a lot of different things that are all kind of interacting with each other, and that are making it hard to ensure that everybody can get the treatment that they deserve.
Based on what you just said, I have two questions for you. So, when you talked about a stigma against people who have a drug abuse disorder, do you think this stigma might prevent some people who have a drug abuse disorder from realizing that they do have this problem?
Yeah, absolutely. And I think that is so common, especially in the context of alcohol use. So alcohol actually kills more than twice as many people in the United States each year than opioids. Um, it's it's really a lot of people who are dying from alcohol related causes each year, and some of that is from downstream health effects like cirrhosis, but it can also be alcohol involved crashes. It can be domestic violence. It can be fights that happen. So alcohol is implicated in a lot of different causes of death. Um, and and at the same time, our society actually really celebrates alcohol. We think about, you know, celebrating, I don't know, an anniversary or a birthday, or I don't know, some of the other celebrations that normally happen in our society. And all of those typically involve alcohol. And it's really, really common. We see alcohol in movies and ads and people having a great time and not worrying about things. But like most Americans don't know that like alcohol is a risk factor for at least 7 different types of cancer, including breast cancer among women. So there's kind of this like knowledge gap between like what our society says about alcohol and then the harms that are coming out of alcohol. And as a result, so there are, I believe, about 11% of adults actually have an alcohol use disorder. But if you look at like the percent that received a medication in the last year, it's like 2% of people with an alcohol use disorder are actually prescribed treatment for alcohol use disorder. So that shows exactly the point that you're making, that like a lot of people, A, may not realize that they have unhealthy alcohol use or an alcohol use disorder. B, even if they do, they may not know that it's a medical challenge, that they can go and talk to their doctor, and that there are medications that can help with things like cravings. And then like getting over that fear too of like going to talk to your healthcare provider and asking to try a medication. Those are all really big steps. And I think that because there's this normalization of alcohol within our society, it kind of exacerbates the stigma around seeking treatment for it or saying that you want to cut back for your, for your health. They're kind of at odds with each other, and I think it really does contribute to people may people not necessarily feeling like they can or want to get treatment for it. They may not realize that they have a problem in the first place.
I noticed when you were talking about solutions for people who have an alcohol abuse disorder or any other type of drug abuse disorder that you never mentioned the supply of drugs in the country as a factor. I know throughout the country's history, we've tried to ban certain stuff or restrict it heavily. So why do you not think that this is an effective policy?
Yeah, so I think there is definitely a relationship between supply and demand. That said, like and actually when the country um, went through a period of prohibition, there was like a decrease in the alcohol related deaths. But there were also unintended consequences from prohibition, like people creating their own alcohol, like moonshine, and going blind because they weren't, distilling it properly. So I think, again, going back to one of our first topics of like the tie between philosophy and public health, this is like a really critical question of what is the right relationship between regulating the supply of drugs, and allowing personal liberties in accessing them. Um, and my own views on this have actually changed over time. Um, when I first started working in substance use research, I actually was firmly to the side of thinking that like we should make the drug supply safer. We should liberalize the drug policy environment. We should legalize everything under the sun, and then we can regulate it, right? If it's regulated, then we know what's going into the supply. People won't get sick and stuff. So I actually started out with a very, very like liberal progressive view on this topic. But my own research has has actually like shaped and changed my views over time. And that's because I've been involved in a number of studies where we've looked at the overall alcohol policy environment, or we've looked at the overall cannabis policy environment. And those environments can be shaped by things like, you know, what's the age for a minor to get a driver's license, which you're undergoing right now with your driver's ed training in California. But also, you know, can bars and restaurants have things like happy hours, or what are the taxes that people pay on things like alcohol, and what's the price around it? So there are all these different types of policies that impact alcohol, they impact cannabis, they also impact cigarettes and vaping devices and nicotine. And it turns out, and I guess this is very logical actually, but I have continuously been surprised by it since I started out with that kind of perspective that I just shared with you, that really the more restrictive the policy environment is, the fewer downstream impacts you have. So, for example, a more restrictive alcohol policy environment is associated with a reduced risk of alcohol-related deaths from domestic violence, or a more restrictive alcohol policy environment is associated with fewer car crashes involving alcohol, which is very, very logical. And so then it's a question of like, well, what's right for our society? Do we want to ban all alcohol and go back to prohibition? I don't think so. Like, I don't think that that's politically viable. I don't think that that's like the right thing to do either. And so then it becomes a question of, well, how can we make it safer? And what are the most effective policies that we can implement in order to reduce those harms? And it turns out that actually adjusting the price of these products is really, really effective. So states that have higher alcohol taxes have fewer alcohol related deaths. So I think it's about being more specific and more nuanced. In terms of the illicit drug supply, which involves opioids, specifically heroin and fentanyl, I think it's very, very challenging because we have obviously a supply and demand side among consumers who are using these, but it's very, very unsafe. There are also adulterants in the drug supply, like xylazine, which is like a veterinary tranquilizer that somehow made its way into the fentanyl drug supply. And it causes these horrible infections. Like, people don't know what they're getting a lot of the time. But then there's also this supply and demand problem with treatment too, right? Where if say we cut off all fentanyl trafficking from all places tomorrow, and there's no more fentanyl in the United States, I don't know that our treatment system is actually equipped to treat people ethically, compassionately, with evidence-based methods in order to meet that. So I think, again, it's about trying to strike the right balance. Obviously, we want to reduce illicit substances coming into this country. We want to prevent future generations from developing substance use disorders in the first place. It's very, very tricky, though. The other thing around opioid use disorder is that when people go without opioids for a period of time, their tolerance changes. And then if they go back to using the same amount that they used before, they're at a very high risk of overdose and death. So like cutting off substances can like also have downstream impacts on mortality. So that's all to say, it's complicated, it's nuanced. And I think we need to be really critical and thoughtful about what the risks and potential benefits are of policies before we enact them.
Of course, and many politicians now these days view issues, especially like the one we're discussing, as very clear cut, and they have just like one solution in mind that they believe will fix the entire problem. And it's very easy to believe people like that. Um, but focusing on what you would do, if you could change one policy in the United States regarding alcohol or drug abuse, what would you do?
Gosh, I think I might introduce a minimum price on a standard drink of alcohol and have that increase with inflation over time. And the reason why is because, as I mentioned, alcohol kills more than twice as many people as opioids do each year. So, like in terms of the public health benefit, it might be a lot higher from that. It's also not coercive. It doesn't send anybody to jail. It doesn't involve the criminal justice system whatsoever. Um, and it would incentivize people to spend their money on other things that are probably more beneficial to their health than alcohol. So if the price of alcohol goes up, and it becomes too costly, people then say, well, I think it makes more sense for me to spend my grocery money on bread and eggs and milk and vegetables this week, right? And I'll forego that. So I think that that's a really powerful type of cost intervention that we could consider. I don't know that it's politically feasible, but I think it could improve the health of a lot of people, while also reducing the negative consequences. I don't know that there would be a lot of negative health outcomes that would come from that. And, going back to this question of equipoise, right? I think it's really important that we don't do harm. We don't inflict harm on people. So I think these pricing policies hit that balance pretty well. But it's hard to choose. Like there are a host of other things I would do too. For example, like the telehealth flexibilities for prescribing medications for opioid use disorder are going they're going to end soon. There's supposed to be like a special registration process for telehealth providers to be able to continue providing. But I think telehealth is so important in increasing access to care, and not just for addiction, for mental health in general, for even some aspects of primary care. I myself have used telehealth for acne medication because I had so much stigma about acne for so many years that I never wanted to go to the doctor and talk about it, but then telehealth made it possible, for example. So I think there are really important provisions around telehealth that need to be extended. I think they're really important pricing policies related to reimbursement rates that need to be enacted. The medications that we pay for as American consumers are so expensive, and there are many medications that are just out of reach for consumers or not covered by health plans. Not to mention like universal health care, right? So there are so many amazing policies that could be enacted. It's very hard to choose, but I think if I had to stick to one that I could do tomorrow in the current policy environment in which we would live, I think it would be some sort of pricing strategy around alcohol, specifically with the aim of reducing substance use challenges.
You said that this wouldn't be politically feasible. Just out of curiosity, what are the arguments against policies like what you just mentioned?
Yeah, so the alcohol lobby is very, very powerful and very, very rich in the United States. And by the alcohol lobby, I mean the producers of alcohol. So these are, companies that distill bourbon and whiskey and beer, the beer producers, the wholesalers, bars, restaurants, wineries, breweries. And this is their source of income, right? They sell alcohol, and that is how there's, a lot of people make their living. So the most common arguments against pricing policies are that it's going to really impact the economy. Small business owners that, have liquor stores, restaurants, bars, they make a lot of, well, restaurants and bars make a lot of money from alcohol sales. Obviously, liquor stores make almost all of their money from alcohol sales. And so if you increase the price of alcohol, there's a concern that people will buy less. What I like about the idea of a minimum unit price, which is a little bit different than an alcohol tax, is it's saying that basically a standard drink needs to be sold for, say, $2 or something. It can't be sold for less than that. By enacting that type of policy, it actually lifts like the prices all together. And because of the increased prices, there's the possibility that these groups will actually benefit financially from being able to sell alcohol at a higher price. That said, there's just so much industry opposition to this, and concern that it will hurt local economies and the national economy as well. So I think that's the biggest challenge in trying to implement a pricing policy for sure.
How do you hope your work will impact future generations in the field of public health?
Yeah, I think what is starting to become kind of the way that I approach public health research and public health policy solutions is, where is there an opportunity to make a meaningful difference in the lives of individuals? And where is there an opportunity to kind of find the right hammer for the nail, where there's a good fit between the problem and the solution? That's kind of the philosophy that I've been approaching my work with. I don't know, I haven't been, hopefully I'll be successful in the future with passing some of these policies. But I think trying to bring a sense of optimism, problem solving, and creativity could yield successes down the road. And I hope that I'm able to enact policies that make the country healthier, that make my state healthier, that make it so that people don't suffer from downstream impacts of substance use. It's so painful. These health conditions don't just affect the individual, but they affect the children and generations to come. Also, when somebody dies young from a substance use disorder, like, it's also somebody who could have been a productive member of society and contributing to the economy, right? And it's like generations of work cut off. And so I hope that my work is able to improve the lives of others so that our population can live healthier, can live longer, and can be happier. Um, yeah, might be idealistic, but I think it's possible.
Well, this has been a very insightful conversation. I certainly learned a lot from you. What do you wish to leave the audience with before we close?
Yeah, I think one of the things I'd like to leave the audience with is that these challenges are really complicated. And you alluded to this earlier, John Lincoln, when you were talking about politicians, having a simple solution like we're gonna eliminate XYZ. Um, but in reality, these problems are complicated. They require thought. They they require um, compassion and humility, and bringing like all stakeholders together to really try to find a solution forward. And so I think I would want to leave your listeners with that I hope that you have a sense of kind of how complicated some of these things are, but it's worth fighting for them, so that you know we can reap those benefits as a society down the road.
Thank you so much for sharing your valuable time with us. I hope that you, the audience, have learned just as much from this conversation as I did. And thank you again for joining me on this episode.
Thank you so much for having me, John Lincoln. It's been great to be here.
Well, that pretty much wraps it up. Thank you so much for watching. Until next time, see ya.